Honorable Minister Jane Aceng.
Uganda is Ebola-free. This announcement, conveyed by the Minister for Health, Dr. Jane Ruth Aceng, now puts to rest uncertainty of the 8th Ebola outbreak in the country.
For this current Ebola, we had a response plan that was costed at $55 million to control the outbreak. That does not include the health workers and the infrastructure that is already on the ground. Every outbreak, we insist on making sure that we don't remain the same.
The last confirmed case was discharged on 14th March, from which a 42-day countdown started, leading to today's declaration. The countdown represents the 2 incubation cycle of the viral infection, after which it is confirmed that there are no traces of active transmission.
Ebola is endemic in our country and many other viruses. So to ensure that we quickly detect, Uganda with her partners have been building the systems. Strong laboratory systems, building capacity of human resource in the different pillars that were highlighted earlier.
In addition to assistance in money, the United States has continued and will continue in future occasions to lend our experiences, our know-how, and collectively learn together how to continue to fight these disease outbreaks.
The survivors, also in attendance, want more support from the Ministry of Health.
Most important is the psychological aspect, handling the psychological aspect of the survivors in their communities.
Meanwhile, the Ministry of Health and partners like the World Health Organization and Africa Centers for Disease Control see an opportunity to further research about the Sudan Ebola strain, including in areas of finding a potential vaccine.
Trial started 3 days into the response and was handwork of previous preparations in 2022, and that's why we were able to start on time. It had 3 basic objectives: safety, efficacy, and the third component is immunogenicity. Currently, we are in data cleaning and subsequent analysis, and then the results will be presented after.
A few years ago, it would be improbable to imagine a case fatality ratio of 28%. But yes, despite mourning our friends and family that we've lost, we are really in a stronger place than we've ever been.
The declaration to mark Uganda as free of Ebola 87 days later after the initial outbreak in Jan is very important for the country because it cuts across and the ripple effects are felt across the economic and social strata differently. The impact can only be told by the people who were affected.
We didn't only refund money for accommodation, but we also refunded monies for the activities, because these tourists don't only come to stay. They will go for medical residency, they will do their volunteership work, but over the weekends they will definitely want to step out and check out the countryside. So in terms of impact, we were hit to the extent that we even had to send off some of our staff because we couldn't hold on to the numbers of staff in terms of sustainability. So this really means a lot.
The fact that the country's been declared Ebola-free is fantastic news for everyone here, obviously, but also for volunteers and tourists like me. It means I can continue doing my work worry-free.
Uganda is safe.
From this year's outbreak, there were 14 reported cases, 12 confirmed, 2 probable, and 2 deaths across 7 districts and 3 cities. 10 people recovered from the infection. Walter Mwesigye, NTV, Mbale District.